Hi everyone, welcome to the first episode of the Confident Physios. My name is Shrija and I'm an experienced MSK physiotherapist currently working in the UK. I help the physiotherapy students, new grad physios to improve their clinical skills, navigate through their placements and gain more confidence. So today we are diving into something very important that almost every physio student goes through. That is the top 5 mistakes every physiotherapy student makes during their assessments and how to avoid them. So if you're a student or a new grad or an experienced physio who is currently nervous, unsure or stuck, then this episode is just for you. Trust me, I have seen so many students make these mistakes hundreds of times and it's easy to fix them if you exactly know what you're looking for. So let's get into the first mistake that the physiotherapy students generally make. So let's start with the mistake number 1. The first mistake that most of the physio students do here is not having a structured assessment plan. I have seen so many students who walk into their placements without having a proper plan, feeling very nervous and very overwhelmed. What happens because of this is they become very confused to where they should begin the assessment from. They keep jumping from one test to the another without actually getting a diagnosis or a conclusion and not being able to plan a treatment as well. So what's the solution here then? Always have a step-by-step framework from where you're going to begin and where you're going to end. So like you can start with your subjective assessment, move on to your objective test, then to your proper assessment and your treatment plan. For example, if you have a patient come in with a shoulder pain, so you can then first start with the patient's history, the present complaint, then you can move on to your objective test and then you can plan a treatment for them and your long-term goals and all of that. Now, if you want, I've created a very simple MSK assessment cheat sheet with a very simple layout or a framework. You can download it from the description box. I'm going to put the link in there. Or you can also download it from my Instagram account. I will put the link in the bio. The mistake number 2 is relying on your theory and not on practice. I've seen so many students who rely too much on their textbooks, who memorize their textbooks, but they don't put all of those things into practice. There are a lot of students who are very confident in their theory, but they freeze as soon as you ask them to see a real patient. Now what's the fix? It's practice, practice, and practice. Try to practice on your friends, family, colleagues, doesn't matter. You can observe your senior clinicians, try to analyze like what are they looking for? What is the clinical reasoning? What are the objective tests that they are trying to do? Why they are doing these objective tests? This will help you to understand that what you are supposed to do in your next assessment. Here's a small tip that I always give most of the new grads or physiotherapy students is, try to record yourself while you're doing any sort of assessments on your friends, family or colleagues because this will help you to highlight what the gaps are present, where do you actually lack as well, and this will also help you to prepare and be more confident before you actually enter into a clinic to see a patient. Remember that practice is what makes a confident physio separate from the students who actually struggle under pressure. So let's dive into mistake number 3. Your mistake number 3 is the fear of asking questions. A lot of students, they fear that if they ask questions to their friends, colleagues or their professors, they might come across as incompetent. Just because you're asking questions doesn't mean that you're incompetent or you know less than the other people. What you can do is, if you're scared to ask questions, you can put questions across to your professors like, well, I've seen a patient in the OPD or in the clinic during the placement and I saw that the patient has a shoulder flexion limitation or a shoulder abduction limitation. Can I do X or Y objective test on them or do you think there's another approach? If you ask questions in this way, this will make the professor feel that you know what you're doing, but at the same time, you're more eager to learn as well. Remember, your professors always appreciate students who are always eager to learn. They are more curious and they're always reflective as well. So don't let your fear hold you back for asking questions. Remember, asking questions will always accelerate your growth. So let's go to mistake number 4. Mistake number 4 is ignoring your clinical reasoning. A lot of students, they perform the assessments very mechanically, but they forget to ask the why behind each step. So you'll find them going from test to test, but they actually don't know why they are doing that test. So what's the solution here then? Always have a mental flow chart. Remember that I'm going to go from a subjective assessment to a objective assessment, then to the analysis, and from there to a proper treatment plan. So every time you're performing any objective test or every time you're asking a question, ask yourself mentally, what is this question answering for me? If I'm doing a specific objective test on the patient, which why is this test answering? Like, how is it going to change my treatment plan? Always remember, if you're mentally going through the assessment while you're physically assessing the patient, this increases your chances of accuracy and it will also make you more confident and you will look more professional in front of your patients and in front of your professors as well. So let's go to mistake number 5 and the last one, which is the lack of confidence and communication, which is one of the major problems when you're just starting as a new grad physio or a physiotherapy student who is in their placements. I have seen so many students, they enter into their placements or into the clinics so nervous, because of which you always end up fumbling. So you misjudge and you misobserve as well, which is why you don't get an accuracy in your treatment plan or in your diagnosis as well. Plus, you come across not very professional in front of your patients and in front of your colleagues and your professors as well. So how to fix it? Now remember, practice. As I told you in the first step as well, practice and consistency is what will help you. What I used to do is, I used to go back home, and which you guys can do as well. You can go back home, you can practice with your friends and families. So always prepare like short phrases. For example, if you're going to try doing an objective test on your patient, first try doing the same test on your friends or family. And then think, how am I going to like actually explain this objective test to my patient in a very simple and a layman language. If you keep practicing this, the next time when you see the patient and you're doing the objective test, you remember, you have it in your brain that, okay, I can explain this test in a very simple way to the patient as well. Remember that practice and consistency is the only key that will help you to gain more confidence and gain better communication as well. Try looking at your voice, try to looking at your posture, the clarity with which you're speaking. All these factors matter when you enter into your placements or when you start working as a new grad physio. Remember, whichever experienced physio that you're listening to, you're looking up to right now, was once a very nervous student, including me as well. But the key here is consistency, practice, and reflection. So if you want to avoid all these mistakes, either you can download the cheat sheet that I've prepared for the MSK assessment from my Instagram bio, or just DM me MSK and I'll send the link to you. I'll send the PDF to you as well with the MSK assessment cheat sheet. And also don't forget to subscribe to the channel to listen to the next episode of the Confident Physios, wherein I'm going to talk about how you can clear your exams with good marks without panicking. And thank you for listening to the first episode of the Confident Physios. And I'm very excited to share more tips and tricks so that you can become a confident physio.